Welcome back. Thank you so much for staying with us. You're watching Morning Cafe. It's Health Thursday, and this morning we want to focus on children. We're talking about asthma and respiratory tract infection among children. What are the causes? What are the signs to look out for if you're a parent? Of course, even as a teacher, if you're dealing with these kids, and just to know how different asthma presents itself from adults. And to help us with this conversation this morning is Dr. Everlyne Agisa. Dr. Everlyne is a consultant pediatrician and chest specialist at Gertrude's Children's Hospital. Karibu sana to TV47.
Thank you very much.
How are you feeling?
I feel great. I'm blessed.
All right, we are ready to learn. So let's start us off with the basics. You know, when we talk about asthma, usually we associate it with wheezing. So how would you define asthma, you know, in children, and how different does it present itself in children as compared to adults?
All right. Thank you so much. It's a privilege to be here this morning to talk about asthma and respiratory tract infections in children. So asthma is usually a chronic respiratory problem. It presents very early. We usually are able to diagnose it in children before even they start school. And they usually present with recurrent coughs, coughs that are usually more at night and early morning, as well as on exertion like running or playing or climbing stairs, and when exposed to some things that we call triggers. So like dust or strong perfumes or smells. Usually these triggers or in the environment, air pollution or smoking, as well as if there's cats or dogs and the child is allergic to that or sensitized, then they usually present with the coughs. So usually it's not just cough, they can actually have wheezing or difficulties in breathing or chest pain. So any of those can be there in one child or another. Not all of the symptoms will be there in one child. Some will have the cough and some will have the wheezing. So not all the wheezing is usually due to asthma. It can be due to other things that I'll mention, but that is usually part of the presentations. So for children, we diagnose it because of the symptoms. So it's usually a clinical diagnosis.
Okay.
And we also try the medicines for asthma, which we'll talk about also.
So from what age? If you're talking about sometimes children who are running around playing, and of course these triggers that cause these, you know, asthma, coughing, wheezing. So at what age? And can it be, say, diagnosed on preterm babies when they're, you know, not already walking and running around the house? So
not really. The pathophysiology for asthma, even though it presents early, we usually don't diagnose it that early in preterm babies. However, the preterm babies are predisposed to get asthma because of the sensitive lungs, because they were born before the lungs were mature. And the insults that they encounter during that early period, some of them usually need oxygen and some ventilation support. So the airway is already injured and at risk. So very sensitive. So, however, the most common age we diagnose it is from 1 year, to around 3 years when they start school.
So why is there sometimes a lot of misdiagnosis around asthma in children? Because sometimes it's, you know, confused for asthma or bronchitis. So why is there a lot of, you know, misdiagnosis in children?
Yeah, that's a good question and a very valid one for a lot of our parents. It's very difficult to diagnose asthma in that early age also because of concurrent viral infections that also they get a lot, what we call bronchiolitis, so viral bronchiolitis, which also presents as wheezing and coughs. And the difference is usually sometimes they have a fever. So those children are very young. And they are not able to do the lung function test that we do to confirm the asthma symptoms if they are there. That is a spirometry. It is usually an effort-dependent test that we do from 6 years of age. So that's why it's very, very difficult to call it asthma when they're very young. So a lot of time we manage as asthma, but we call it asthma later, after 6 years, when we are able to see that the early symptoms did not clear. They are persistent.
So what are the dangers of trying to treat pneumonia or bronchiolitis as asthma? Does it cause any dangers in the long term?
Well, yeah, the management for the two problems is different. because pneumonia is an infection.
Yeah.
It is an infection of the lungs caused by viruses, bacteria, or fungus. So